All right, so we're going to be talking about the tripod and the foot, how to better plug in and stabilize, and even to help shifting weight and with balance. So basically, I'm going to put my foot up on the step. You can do the same, especially if you have difficulty balancing or if you have intolerance to bearing weight or difficulty bearing weight because of pain, or just to get some sense of stability. So I have a walker here. If you have a walker, or you can use a table, that can be helpful too, like leaning over a table. But the problem with the table is you might have difficulty seeing your foot if the lip of the table is in the way. So you either have to be in a stride position like this with one foot out in front. That's one way to do it. It's a little more challenging with two because you have to be back in the skiing position, which can be a little slippery. You might slip off and fall. It's a little more, it's a safer here. You just have to have more weight in that front foot. So if you do have a walker, doing something like this is a little bit better, or you can just see your feet better and you can be more in that skiing position over the walker here. It's a little safer. Not necessarily with the step stool, but on stairs with a rail or two rails, having one foot up on the step. That also is one way to do this. I apologize, you probably can't see my foot very well because of the nature of this step. Let me grab something with a little more contrast. There we go. A little better. So if you look at my foot, you can think about the tripod, my heel, pinky toe knuckle, big toe knuckle. Now what I want to do is I want to map out the parts of my foot on here. So I want to think of my seat belt for my hip. I want to pull my hip back to my heel. I want to now lunge, and that's to load my glute, my buttock. I want to lunge my knee out towards my pinky toe knuckle here, and that's going to be getting into my soleus, my lower calf. Make sure you're not getting pain in the knee. You want to be in the calf, okay? And then I'm going to be pushing out with my knee. So if we look at that from a different angle, butt, hip back, I'm hinging here, okay, to load the heel, knee out and forward towards the pinky toe, and pushing here, that's going to be the gluteus medius on the side, and forward a little bit to load the calf, the lower calf. I want to protect my knee. I shouldn't be feeling pain or overloading the knee. I also shouldn't be feeling too much in the quads. Sometimes if we're overloading those quads, it gets so tight that it compresses. That's oftentimes what will cause a lot of the pain in the knee, or if you don't have the mobility. So that's something to work on. Ankle mobility, keeping the heel on the ground, being able to come all the way down without pain or difficulty, and have the strength to come back up. Again, the knee is towards the pinky toe here. And then lastly, it's the inner thigh pulling in towards the big toe. Now, when I'm going down into this, I'm actually twisting back into my buttock and heel. I'm not emphasizing the in, because if I emphasize the in part, my knee is gonna buckle and I'm gonna collapse. That's not a very sturdy position. So I wanna keep my big toe knuckle down. That's where I'm gonna just think about my button here on my shirt or my sternum. I'm gonna use my own weight to kind of keep it down. I just want enough tension here to keep it from my knee from swinging out, but I don't need to work very hard at all there. If anything, it's more pull back in the hip and push out here versus pulling in here, just a very little bit, just enough to keep it steady. Keep my foot flat and stable so I can balance, right? But don't overly challenge yourself if you're not ready for it. Something to progress up to, and of course you want to do that both sides if you can.